This is Day in the Life, part of a series of videos showcasing the amazing diversity of health-related jobs. In these interviews, we'll hear a little bit about what a day in the life of a health professional may look like. We will hear about the importance of partnership with and connection to community to support health for all. We're here at Mount Sinai Hospital, and I'm with Jana Stringfellow and Orletta Garmon. They are both patient navigator community health workers. So what they do is really important work, and we're going to get some information about what it means to be a community health worker today. So can you please tell me, Orletta, on a day-to-day basis, what are some of the most important things you do as a patient navigator community health worker?
Okay. After going into the community and finding the women and signing them up for the mammogram, I have to set up appointments, find out their insurance, make the appointment, make sure they go to the appointment, make sure they have transportation, getting to the appointment. After that, getting them to the mammogram appointment, getting the results back, make sure follow up with that. If they don't go, I go to their houses, I go to the shelter, because a lot of them live in shelters, and find them and bring them back to care.
Jana, can you please tell me what are some of the things that you do that contribute to the healthcare team?
So if someone tells you you need a mammogram, what do you do? How do you get a mammogram? So we connect them to the healthcare team. We get them to the doctor, and it's a two-step process. When we work with healthcare teams, they have to meet with their doctor first to get a referral for any service. So sometimes that's their first time they're going to a doctor. So we're connecting them to the healthcare team, and we're also helping the healthcare team follow up. If there's another mammogram or diagnostic mammogram that they need to do, we help make sure the patient is scheduled for that. If the patient doesn't show, we are calling that patient, following up. We're going to that patient's house. So we're kind of like the legwork, ground level help for the healthcare team.
Thank you so much for being here and for sharing what you do. It's amazing work. Thank you. We're here with Dr. Virginia Bishop, an assistant professor of preventive medicine, and Evelyn Cordero, who is a research assistant in the Department of Medical Social Sciences at Northwestern University Feinberg School of Medicine. Thank you so much for being here today, Dr. Bishop and Evelyn. Dr. Bishop, can you please start by telling us some of the most important things you do on a daily basis as an adolescent medicine physician and a public health educator?
So probably the single most important thing is teaching. I actually feel that it is not an effective interaction if I don't learn something and the patient doesn't learn something. And then after the clinical setting, I teach in the Masters in Public Health program. And again, effective teaching, making sure that people learn something, that I learn something. I think one of the things that is most touching to me is when I have previous patients come in with their children. And they share with me that I made an impression on them, or that they think that it would be important for me to partner with them in their journey for the optimum health for their child or their teen.
Evelyn, as a research assistant, what are some of the most important things you do on a daily basis?
Well, currently my primary role is to recruit for a research study. The study focuses on young adults and adolescents who've been diagnosed with cancer. So it's really important when I meet them that I'm able to make a connection with them, because I only meet with them for a short period of time, and I have to deliver this message. Before this, when I was studying my undergrad at Northwestern Illinois University for community health and wellness, I interned at Genie's non-for-profit called Youth Empowering Strategies. For short, we call it YES. It is a teen health education and advocacy program based in Humboldt Park. We would teach about nutrition and fitness. After we taught a few lessons, there was a couple times where students would come up to me and share with me that they went home and shared this information with their family and their siblings, and that their family no longer bought soda anymore or fried any foods. And it was just these really small, minor changes that I got really excited about, because I knew long-term they were going to pay off.
Amazing. Thank you both for sharing and being with us today.
Thank you for
You're
inviting
welcome.
us.